Hey, good evening, everybody. Dr. Nathan Thompson with Exemplify Health Center, an affiliate of the Wellness Way. Happy Monday evening, guys. Hope you guys are enjoying your Christmas season tonight. If you are watching live, make sure that you say hello and make sure that you let me know where you're watching from as well. I always love to hear where everybody watched from all across the United States, from Canada, across the Pacific Ocean, Australia, New Zealand, across the Atlantic Ocean in Europe. So thank you guys for joining us. We're going to give you a different perspective tonight when it comes to acne, about finding the cause. And no, it has nothing to do with your skincare routine. I can speak from this from personal experience, as a lot of people can probably speak from it from personal experience as well. So we're going to talk about acne tonight. Again, guys, if you are joining us, make sure that you say hello and make sure you let us know where you are watching from. And also make sure you tag somebody who might be suffering with this. And I know that they'll have tremendous benefit from watching specifically about acne. Guys, I'm going to make a couple of bold statements when it comes to acne. Number one is it is not a skin issue. A skin is a reflection of what's happening deeper. Acne is actually an infection issue, not coming from the skin. I'll show you where it's coming from. And it's also inflammatory, and it's also an issue with hormones, which is why people will get it at certain times of the year, also when, or certain times during their lifespan. And also they'll get it when they're taking specific hormones, and also why they get it during teenage years, and also why it will actually go away at certain times, but also specific conditions, especially when it comes to females, like PCOS, why they actually have acne. I'm going to show you that as well. So guys, if you are joining me on this platform on Facebook at Exemplify Health Center, or on Dr. Nathan Thompson. Also, we are streaming on Instagram right now at Dr. Nathan Thompson. So hello to everybody who's watching on Instagram. Thank you so much for joining us. But guys, you can also see the replay. A lot of people ask me, hey, I have so-and-so, they aren't on Facebook, they're not on Instagram. Where can they find these videos? We upload all of these long format videos onto YouTube, and then also onto Rumble, because YouTube is known to ban certain videos that I do. So you will see all of those videos uploaded to YouTube and to Rumble. So guys, you'll be able to watch this, on those platforms. It might be a little bit easier also to share the link directly with someone who also needs to hear us, who might not be on Facebook and who may not be on Instagram as well. So guys, we're coming up to T-minus 24 hours for our last inflammation event here at the office, Exemplify Health Center. This is an in-person event. If you guys are watching right now from the Chicagoland area, you can go to the top of the page and you will see the link on our Facebook page at Exemplify Health Center, Dr. Nathan Thompson, to be able to register for our last inflammation event of the year. I think we have about 18 people registered for that event. We're going to be talking about inflammation, which what I'm going to talk about today is an inflammatory issue going on, and how inflammation is the spark that leads to every single disease, guys, that's out there. Whether it is weight loss resistance, whether it is thyroid disease, whether it is joint pain, whether it is autoimmune conditions. Guys, so many people want to balance their hormones. Your hormones will not be balanced if you are inflamed. In fact, hormones respond, they do not cause. Although they will make you feel lousy, they're not the reason why you feel lousy. And in fact, I have a video on Facebook that absolutely just floored so many men out there, because I talked about why testosterone replacement therapy is not a good idea. And I went over the science behind that and why doctors aren't testing those things. And there's so many men that were getting so emotional about why testosterone replacement is not a good idea, because they said, well, I got it and I feel better. I said, yeah, everyone will feel better if you start pumping yourself full of hormones, but you have no idea what your body is doing with those hormones. This includes women as well. Because remember, hormones are responders to stressors. So if your hormones are going down, men, like your testosterone, you have to look deeper as far as why your body prefers those things to actually go down. And you have to fix the cause, because if you don't, then the only thing that it will do, while temporarily making you feel better, it will also make you sicker, because it's going to put a lot of extra stress on the liver. It's going to cause the same mechanisms that had you have low testosterone, your body will drive it down and will do things with those hormones that aren't very good. So that's why, guys, at that inflammation event, we'll talk about why you have to handle inflammation first and foremost in order for you to be able to have a healing response. Guys, everything in medicine does, what they're really trying to do is that they're either trying to manipulate inflammation, or what they're trying to do is manipulate the effects of the inflammation that the body is trying to do in order to be able to adapt. So again, guys, if you're from the Chicagoland area, go to the top of this page and get registered for that. We'll still have some spots available for it. This will help you to understand the first steps that you need to take in order for you to have total health victory. From a different perspective, guys. There's so many people who want to argue from their medical perspective, but we don't look at it from that medical perspective. It's never a this for that, and acne is certainly one of those things as well. So, guys, we're going to dive into acne from a different perspective. And again, I'm going to show you a different perspective, how you should start looking at this differently. And in fact, when I talk to you guys about what's known as the Swiss watch principle, you'll understand that it is never a this for that. There's so many times when people say, Dr. Nate, I have this. What do you take for this? I have this. What do you take for this? And guys, the question needs so much more context, okay? So much more context, because you literally could look at 19 different scenarios for one thing that you have to look at in order to properly address what's happening with quote unquote symptoms. So even, guys, when you talk about acne, and if you said, hey, so-and-so has acne, the first thing that people are going to look at is they're going to say, well, what do I need to put on my skin? Because the symptom is on the skin. So therefore I need to put something on the skin. Guys, this is why we're so sick as a country, because we think everything is a this for that approach. Now, let me ask you a question, guys. And I love questions because I want you guys to start thinking a little bit differently. So here is the question. The question is this: why is it? Why is it that two people can use the same exact skincare routine and one has acne and the other one doesn't? See, when someone starts to get acne, then immediately they think, I need to wash my face more. I need to dry out my oil glands more. I need to put salicylic acid on it. And we always think that it's a skin issue, but I'm going to show you why it's not a skin issue. It's a systemic issue. And I'm going to show you exactly where you need to look. I'll also show you the first steps that you need to do when it comes to being able to overcome acne. And this also includes ladies as well. But it just goes to show you that it's not your skincare routine. And in fact, even when ladies are suffering not only with acne, but they're suffering with things like rosacea as well. And you see all of these miracle products that are going to clear up my skin, and they may temporarily clear up the skin. But I want you to think of this. If you stop using this miracle skincare product and the acne comes back, it means that you did not address the cause. So, guys, I can't stress this enough, that when it comes to every single health condition, it's an inside out approach and it's not an outside in approach. And even in natural healthcare, they still are getting it wrong, in which if you would ask someone in natural healthcare, a lot of them would say, well, what natural things can we put on our skin, or what can we sell you in order to help with acne? Okay. It's an inside out condition and not vice versa. So the answer is this. We ask the question, two people can have the same skin care routine. One gets acne, the other one doesn't. Why is that? Because they're putting the same things on their skin. The reason why is this, is that acne is not a skin issue, but it's an inflammatory issue that also can be exacerbated by increases in certain hormones. So you have to look at, guys, inflammation from a systemic standpoint. And you also have to look, very important, especially when it comes to ladies, your specific hormones. And I'm going to talk about specifically the hormone that's going to be involved with this. So always, guys, I always want to go to what the experts say about acne, and I'm going to take you to the Mayo Clinic. All right. The reason why I like to use the Mayo Clinic is because from where I am from, if a doctor can't figure it out, and people throw up their arms and they say, well, we're going to go to Mayo Clinic and they're going to figure this out. Mayo Clinic are actually They're very good diagnosticians. They'll do testing that maybe your general practitioner won't use. They'll do testing that your MD won't use. But guys, I want to actually reinforce this is even if they give you the diagnosis that no one could figure out, the treatment is always going to be the same, and it's going to be manipulation with medication. Remember, guys, I'll always say this is medications manipulate. Are medications actually needed in order to manipulate sometimes? Yes, because it's a fire department approach. Sometimes you need to put out the fire, but then you sure as heck better figure out why you had the fire in the first place. And number two, after they put out that fire, you better rebuild your body, because after that fire, there's going to be a lot of collateral damage that takes place. And I'll give you a perfect example, because we've had patients who have come and gotten the diagnosis from the Mayo Clinic, but the treatment of it still left them sick. And it actually takes me back to a young male patient that we had a couple of years ago who went to the Mayo Clinic because he was having problems with gastric erosions. The reason why he had gastric erosions, literally his esophagus was actually burning up and it was breaking down, was because he was vomiting 5 to 6 times a day for an entire year. So here he had terrible reflux, gastric erosions. He was bleeding into, in the esophagus. And so Mayo Clinic did all of these tests. They did an upper GI, they did a lower GI. They looked at all of these different tests, and their end result was that they would just put him on a PPI, or a proton pump inhibitor, also known as a reflux medication. And they thought, well, maybe if we just lower the stomach acid, then he's not going to be burning his esophagus so much. But then when he came here and had no answers whatsoever, and in fact was losing weight, was absolutely wrecked because of literally vomiting 6 times a day for an entire year, as I said, well, maybe we need to figure out why you're vomiting, because it's actually when you're vomiting that's burning the esophagus. Why would someone have extreme nausea and be vomiting all the time? And the chances are, I said, it's probably something involving your gallbladder and your liver. And sure enough, when we actually did testing, even that Mayo Clinic didn't do, which was as simple as doing a stool test, we found that he had multiple infections, had a gallbladder that wasn't working the way that it was supposed to. And it was one of the reasons why he was vomiting all the time. Once we handled the liver, we handled the gallbladder, there was no more throwing up, in which case the gastric erosions healed on their own. So sometimes, guys, you have to heal a little bit deeper. But I digress, because I want to talk about Mayo Clinic, because that's where everyone goes to, and that's where people think are the expert. So what does the Mayo Clinic actually talk about when it comes to acne? So they say that there are 4 main factors that cause acne. The first thing is excess oil, okay? So sebum production. That's coming from the actual oil gland that's feeding the hair follicle. Now, I want you to think of this is that the body never produces excess, okay? So the first thing they're saying, well, your body is messing up and is producing too much oil. That's the reason why. Number 2, it's caused by a clogged hair follicle by excess oil, okay? Number 3, it's caused by bacteria. I actually agree with that, and I'm going to show you what type of bacteria. And then number 4, well, it's caused by inflammation. So it's an immune response. And remember, when people have acne, they will have problems with pus. They'll have problems with red skin. That's an inflammatory reaction. So yes, I agree. It is actually caused by bacteria. It's caused by inflammation. Yes, it can be caused by oil. But the question is what are causing these 4 things to happen? Your body doesn't get inflamed for any reason. The immune system doesn't get inflamed for no reason. It doesn't attack itself for no reason. It's getting inflamed for a very specific purpose. And if you look at how the immune system works, the immune system is actually designed to clean up dead tissue. The immune system is designed to handle a bacteria, to handle a virus. The immune system is also designed to handle a foreign food protein or any kind of foreign body that you might be putting in your body, i.e. breast implants, for example. So what they also say is that certain things may trigger or worsen acne. First thing is hormonal changes. Notice how they say this word right here, known as androgens. So your main androgen, yes, estradiol is an androgen, but a more potent androgen is known as testosterone. Okay. Certain medications, including corticosteroids and also testosterone. Interesting, huh? Because if you look at someone who decides that they're going to try to get huge muscles and they start taking exogenous testosterone, you're going to notice that one of the symptoms of that is acne. Acne on the face, acne on the trunk, acne on the back, acne on the shoulders. The reason why is because when you start taking exogenous testosterone and you drive your levels up to where they shouldn't be, then it's going to cause more sebum production, and that gives it more likelihood of it actually getting clogged and having an immune system response to some of these dead skin cells. It also says that diet. So diet, especially a carbohydrate-rich foods such as breads, bagels, and chips may worsen acne. Now, I actually disagree with that, is because eating carbs doesn't cause acne, but eating carbs actually feeds the bacteria that are responsible for acne. I'm going to show you that in just a second. And then also stress. So stress doesn't cause acne, but if you have acne already, stress may make it worse. Now, I will actually say that stress actually can cause acne because there's really only three reasons why a person gets sick, and it's all tied around inflammation and stress. There's physical stressors, the spine and nerve system. There's chemical stressors, meaning inflammation, gastrointestinal system, the liver, kidneys, whatever it might be. And then there's also mental stress, guys, because when you understand the stress response, specifically when it comes to fight or flight, if you want to absolutely tank your hormones, you want to make your digestive system worse, put a person in chronic fight or flight or make them chronically stressed, and you will see their whole entire hormone system change. You will see their sleep cycle change. You will see their performance athletically change. You will see their whole digestive system profile start to change. So let's see what the Mayo Clinic further goes on to say. When I talk about the treatment, remember, they go with causes, but remember the treatment is always going to be a drug approach. Retinoids and retinoid-like drugs, okay? Basically what they're saying is they're saying something to put on the skin that's involving vitamin A. How about antibiotics? So what do antibiotics do? Anti means against, bio means life, against life, and it kills bacteria. So an antibiotic can kill bacteria anywhere. They can kill it in the gums. They can kill it underneath the skin. They can kill some kind of infection that's taking place within the body. They'll also kill off the microbiome too, in which you do need certain bacteria in order to produce beneficial things in your body. Vitamin K production, for example, short chain fatty acids that help with blood sugar regulation, a lot of different things that you need, but it also will kill that off. So when you look at the treatment, what they're saying right now is they're saying, hey, maybe vitamin A is going to help. Maybe antibiotics are killing off some kind of infection. So they're saying, yes, there's some kind of infection or inflammation that's involved. Azelaic acid and salicylic acid. Basically, what these things are going to actually dry out the skin as well. And you guys know putting salicylic acid on the skin will actually dry it out. So they think, well, maybe we can dry it out in order to decrease the oil production, and also dapsone, which is going to be specifically when it comes to inflammatory acne. Okay. So what they're saying is they're saying we need to dry out the skin, maybe give it some vitamin A, maybe try to lower the inflammation that's taking place, or, and it's always going to be some kind of approach that you're either going to take orally or you're going to put on the skin to try to handle what is basically a symptom of something else taking place inside of the body. So you put things either on the skin or you're going to take some kind of oral medication, such as antibiotics, okay? Or oral contraceptives, okay? So ladies, if you have a problem with acne, how many of you have been put on oral contraceptives in order to help with acne? So you probably have been, on something that is a progesterone and estrogen-based birth control. And doctors say, go on this, and this will probably clear up your acne. and actually manipulating hormones. Even though if you see that your acne gets better, it is a manipulation versus actually finding the cause. Okay. And the reason why is chances are, I will actually give you a preview, is if you have acne, chances are it's a problem with the androgen testosterone, and actually adding more progesterone and estrogens will actually try to balance out the levels between those hormones. But you don't actually raise hormones in order to balance them out. You actually want to figure out why your androgens are actually so high. But so what's so interesting is so many young girls have been put on birth control, which is considered an endocrine disruptor. Let me say that again. They call it an endocrine disruptor just to help with acne. Okay. Now, here's what they also say. These drugs are associated with an increased risk of cardiovascular problems like stroke, breast cancer, and cervical cancer. So literally what you're doing when the doctor says, here's to help with your acne. And oh, by the way, you'll have a little bit clearer skin, but you'll also have an increased risk of having breast cancer and cervical cancer, as well as also having a stroke later on. But hey, at least you don't have any acne. Now, sometimes, and I've had patients who have come in with acne and they put them on the drug spirulactone, which is actually not even a drug for acne. It is a potassium sparing blood pressure medication. Interesting, huh? On a blood pressure medication, which means they're willing to use drugs off label in order to help with acne. Now, this specific type of drug, actually, what's interesting is that it's an aromatase inducer, which means that the secondary effect is that it will actually take testosterone and help it to convert into estradiol, which is interesting because they're actually saying maybe it's a problem with testosterone. Okay. And then you have other ones that are basically derivatives of vitamin A that you can actually take orally. And also that with this one, isotretinoin. Sorry, I'm not a pharmacist. I understand mechanisms of drugs, but as far as trying to pronounce these, holy cow. But they're saying take a synthetic form of vitamin A, but some of the side effects are inflammatory bowel disease, depression, and also severe birth defects. Okay. So far, looking at this, they're definitely not selling me on acne treatment. Okay. Now they talk about what are some other things that you can do in regards to other therapies. Well, light therapy. Huh. Interesting. You mean light? You mean the sun could actually help with acne? Chemical peels. So people who try to do chemical peels might see temporary results, but not long-lasting results. Drainage and extraction, especially if the infection gets very large, starts to get backed up. Or what's interesting too is they say, well, we can also inject the area with corticosteroids, okay? Which is basically giving a person a high dose cortisol, which is going to be extremely anti-inflammatory. But also what they say is that side effects can cause discoloration in the treated area. What do you mean by discoloration? Well, it can actually turn the skin a brown color. Here's what's interesting, guys, is that if you've ever seen someone who has been type 2 diabetic, lost blood sugar control, high insulin levels, is that it will turn their neck almost a brown color. And that is due to the high amounts of cortisol, due to the high amounts of insulin. So what's interesting is that they say, yeah, we can manipulate it, with the immune system. And that's why, guys, corticosteroids, yes, they will decrease inflammation, but what they will do, especially if you're taking it systemically, is it will mess up your menstrual cycle. Yes, it will cause you to gain a tremendous amount of weight. Yes, it may make your joints feel better, but it will leave you chronically tired with no energy as well, because it's actually going to be manipulating the hypothalamus and the pituitary gland and the adrenal glands as a result. And guys, long-term corticosteroid use can take a year a year for a person to be able to recover, especially when you've been on these medications long term. So here's what the Mayo Clinic actually admits. So you look at this, and rather than look at their treatments, figure out what's the idea, what's the goal that they want to use when it comes to their treatments. Here's what the Mayo Clinic admits. Well, vitamins A and D, light therapy, for example, actually help. Okay. So it can help. So maybe we're on to something. Maybe acne can, one cause, be a vitamin deficiency. I don't know too many people who have adequate levels of vitamin A. I can guarantee you most people that we test don't have adequate levels of vitamin D either. But here's what they'll never say, because some of you right now will say, I'm going to go get vitamin A, I'm going to go get vitamin D, and you might not even have a gallbladder, at which point actually makes trying to supplement with it almost useless, because you actually need bile in order to be able to transport those fat-soluble vitamins across the gastrointestinal barrier. And this is why there could be so many multiple reasons why, and you will be chronically vitamin A, vitamin D, vitamin K deficient if you do not have a gallbladder and you are insufficient when it comes to bile acid. What they also admit is they admit that it's an inflammatory issue. So they say, yeah, it's an inflammatory, it's an immune system issue. It's exacerbated by high androgens. And they also say, you know what? We're not opposed to using off-label drugs in order to put out the fire, in order to help you with your acne, whether that be spironolactone, whether that be corticosteroids, or whether that actually be birth control as well. Here's what I find so interesting is that doctors will use drugs off-label, except when their handlers won't approve it. Say, so this is the only time that I'm going to get a little bit fired up, guys. I promise after this, I'll stop. But what do you mean about their handlers? Guys, when you look at, people will ask me about certain drugs that would have been beneficial for the COV, et cetera, like HCQ, like ivermectin. These could have been used off-label for people who needed the fire to put out. They weren't allowed to use this drug, even though clinically it showed that it helped. They weren't allowed to use it off-label. What's so interesting is that doctors actually do have free reign to use drugs off-label in order to try to induce a secondary effect of that medication, like spironolactone for acne, for example. And they have free reign to practice medicine when it comes to that, except when it came to COV, et cetera, because I want you to think of something, is that if that medication actually would have worked and had an antiviral properties to it, it prevented a replication of a virus, would I have taken it? No, because there's other things more powerful, and I understand the importance of keeping your immune system healthy, but there are some people who are very immunocompromised. Could it have helped? I guarantee that it probably could have, in my opinion, but they weren't able to do it. And the reason why, for one reason and one reason only, is because they wanted people, instead of actually for therapeutics, they wanted a vaccine instead. And we know how much of a complete and utter failure the vaccine was. Sorry, not sorry, because they actually just admitted that more people who have been vaccinated are dying from COV, et cetera, than people who haven't been vaccinated. But go ahead and get your booster this year, because boy, oh boy, is it certainly working. Okay, guys, don't forget to use your brain. We have been conditioned to only listen to experts, and we have been conditioned to not actually be able to accept our own ability to be able to reason. And the only thing that they can come back and say to you is, we're the experts and you are not. And we know what we're talking about. Ask them a question that challenges the narrative, and the only thing that they will do is an ad hominem attack to attack you as not being some kind of expert. They'll never try to attack the argument. They will instead try to attack you, which means they've already lost the argument and they're already admitting failure. So I want to show you, go back to a PubMed article that talks about sex hormones and acne. Here's what they say about this, okay? So is there a contribution to your sex hormones? Yes, you have to look at your hormones. I want you to think of this. Someone takes steroid as a performance-enhancing drug. One of the side effects is acne. When you think about teenage boys, when do boys or men typically get acne? It's at its worst when their androgens are at its highest, which is going to be during their teenage years. Is it causing the acne? No, but with the androgens going up, if something is wrong, it will amplify it. So why on earth can someone say, well, I had acne as a teenager. When I got in my 20s, I didn't have any problems with acne, but they never changed anything. Well, chances are their androgens were at its highest into their 20s because of actually inflammatory issues and poor lifestyle and things like that. That actually dropped down the androgens to a point in which you didn't have any kind of overt symptoms of having acne. So here's what they actually say about sex hormones and acne. The sebaceous gland is the main site of hormone biosynthesis, especially for androgens. And acne is the classical androgen mediated dermatosis. So they're saying that that androgens can actually have an effect on the gland, the sebaceous oil gland that's within the hair follicle. Further evidence supports the interplay between, now listen to this, androgens like testosterone, insulin, which is spiked with sugar, insulin like growth factors, and hyperglycemic diet in acne. Androgens not only regulate embryology and lipogenesis or fat metabolism and sebum synthesis in sebocytes, but also influence inflammation in acne. So here's what they say. Special attention should be paid to non-obese patients with polycystic ovarian syndrome and hyperandrogenism, insulin resistance, okay? So what they're also saying is, hey, it's not necessarily because someone is obese that they have acne. Maybe they actually have something known as polycystic ovarian syndrome and insulin resistance as well. Guys, this is why women with PCOS have acne, because they will have a high amount of androgens like testosterone. Can you believe that? So what's their answer? Birth control, and then on something in order to increase insulin sensitivity. And so rather than say you need to be on a very strict no sugar diet, instead, they are giving them drugs for diabetes and they're giving them birth control. Now, here's what happens. Well, you're going to need to be on this until you want to have a baby. Then you're going to have to get off the birth control, and all their problems start to come back, which is why the cause was actually never addressed. So what do they actually say here? They're saying that there's an interplay between your androgens, between insulin, and between a hyperglycemic diet, which is eating copious amounts of sugar, which is going to be 90% of kids today. This is why, guys, acne is not just a skin issue. And it's not, I need to wash my face better. It's not, I need to find the latest and greatest skincare routine that someone is selling on Instagram. It is, we need to look at how the body is handling inflammation and how it is trying to adapt. Guys, acne, this result is on the skin or the integumentary system, but the cause is the immune system, it's the endocrine system, and guys, it's also the digestive system. And I'm going to show you this in just a second. Guys, please make sure that you share this video while you are watching, because this right here, what I'm going to show you is I'm going to show you how we would approach someone who came in with acne. And it actually would go even a little bit deeper than this. I'm going to give you actually a clinical example. And this is actually a teenage boy who had cystic acne, no acne until he hit puberty. And when his androgens started to go up, started to develop cystic acne on the face, on the shoulders, on the back, and all of the skincare routines and all of those different things weren't working. It wasn't a skin issue. Skin was a reflection of what was happening underneath. Now, I knew a little bit about this person's past history. This person's past history had a lot of antibiotic use. So you look at someone when they're young, they have an ear infection. Doctor gives them an antibiotic. They have swollen tonsils. Doctor gives them an antibiotic. Never tries to figure out why it was happening in the first place. So this person has a long history of being on antibiotics. Also has a history of eating what is known as the standard American diet, which is going to be a diet high in grains and high in processed foods. guys, I could look at this test and already know what this person had been doing because the testing doesn't lie. This is one of the reasons why I say a person could be blind, deaf, and mute. And if we would test them, we still would figure out 95% of their problems that are going on. So this is a stool test that we did. Here's what's interesting. Number one is you look at this person not being able to break down their proteins. That's where the first place actually starts, is an inability to properly sterilize your food and also be able to break down your proteins. Number two, you can see that his gastrointestinal barrier was getting inflamed. Where you saw the most problems was that they had what is known as dysbiosis, which is just a fancy word, is there's way too many bacteria that are growing and creeping up into the small intestine. It's called small intestinal bacterial overgrowth. You can also see high inflammatory markers for an enzyme that will cause beta-glucuronidase, known as detox-retox. And then finally, you can see he had multiple infections that were going on, including parasites. And whatever will inflame the gastrointestinal system, guys, will also inflame the skin. Why? Because it's just immunology. So when you look at this, you can see small intestinal bacterial overgrowth, parasites, inability to be able to sterilize their food. But then when you look at the actual profile of the type of bacteria that were growing on that stool test, guys, one of the biggest things that you will see that will contribute to acne is this one right up here. So Bacteroidetes phylum, okay? So you can see how overgrown this is. And this one will have a preference to overgrow when you are eating a primarily animal-based diet. Oh, well, there we go. That's why you need to be a vegetarian or a vegan. No, not necessarily, because most of what people are eating when it comes to an animal-based diet are actually bad animal-based fats. No, not that they're saturated, but that they're actually corn-fed, grain-fed, which changes the fatty acid profile. So some of the things also that are in processed meats are bad. But this one right here is the largest contributor when it comes to acne. And guys, because you will actually see this type of bacteria that will go and migrate to the actual hair follicle and is causing the inflammatory response. But you also see overgrowth of proteobacteria, of fusobacteria, and you look at all of these overgrowths, guys. If you look at this, some of these are pro-inflammatory. E. coli, for example, consumes simple sugars and is lower in individual on a plant-based diet. Well, people on a plant-based diet are going to be eating more complex carbohydrates, which is actually going to be good. Also, Methanobacter brevi, smithii, or Methanobrevibacter smithii, is associated with methane production. This is what gives you incredibly smelly gas as well. And it's increase in diets high in what? Carbohydrates. And so when you look at this, pro-inflammatory, increase in low fiber and high fat type diets. So if you look at all of these overgrowth, what is feeding it? Low stomach acid. What also is feeding it? Been on antibiotics for a long period of time. But what also is feeding it? Actually, the food that this person was eating as a normal diet. So if you actually go and you look at the breakdown of the bacteria in here, you can see all of these Bacteroidetes bacteria are incredibly high, including this one, which is primarily responsible for an inflammatory reaction when it comes to acne. So you see how high this is. Desulvibrio piger, let's say sulfur base. I'm sorry, this is the one that actually gives you very smelly gas, guys. This is the reason why. If someone has very smelly farts, and they smell like, can I say that? Or can I just say flatulence? When this is very high, guys, this is really a sign that something is really off within the gastrointestinal system, which is why they've actually have said that, yeah, the smell of your flatulence can indicate that there is a problem going on leading to colon cancer, which is incredible. So smelly gas. And then also anytime that you have a Methanobrevibacter smithii, this will typically cause the bowels to become paralyzed, in which people with an overgrowth of this bacteria produces methane, will paralyze the bowels. And these are the people who are having problems with constipation specifically. And guys, if you had the choice between being constipated or having diarrhea, diarrhea would actually be preferred. Constipation is terrible and so detrimental to the body. You should be having literally a bowel movement an hour after you eat any kind of substantial food. So if you are eating a substantial 3 meals a day, you should be having 3 bowel movements every single day. And the reason why, guys, is your liver actually detoxes from liver to gallbladder into the gastrointestinal system. So one way for you to be able to remove your hormones, one way to be able to remove toxins every single day is actually through healthy gastrointestinal function. So you can see this person has a ton of bacterial overgrowth. Guys, this is also a great opportunity to say, in this case, taking probiotics is not going to help him. All right. So here you have a problem in the gastrointestinal system, but also you can have a problem with androgens. And this is going to be specifically when we talk about women. So when you look at someone with PCOS, for example, you will see that typically they're going to be very androgen dominant. And so what actually causes for them to be able to retain androgens produced by the ovaries, especially during their cycling years? And it's actually too much sugar. It's actually having a diet that is rich and abundant in carbohydrates. I've never seen anyone develop PCOS by having too many vegetables, but I have seen them when they're having too many refined carbohydrates, like your breads, your cereals, your pastas, and your chips and your junk food and things like that, that we would just consider normal for a teenager to have. So here's someone who had into their 30s cystic acne. This is a Dutch test, measured their testosterone metabolism, and you can see that it's off the charts. And then when you look at things like DHEA, some of these other androgen derivatives, you can see all of these things being extremely, extremely high. And in fact, this one right here is one of the main reasons why a woman, especially after menopause, would have male pattern baldness, especially after menopause. So you can see high in androgens, very high in androgens, and you have to figure out why they're high in androgens. What's so interesting is that if you look at her total estrogen and progesterone, you can see they're at menopausal level, guys, menopausal level. This person here would not be having any menstrual cycle whatsoever given their hormones. So would birth control help this? It would manipulate it, but it's still never getting to the cause, because there's a reason why this testosterone production is so incredibly high. So looking at another PubMed study, Dr. Nate, where'd you get this? Well, I actually typed in this and I looked on DuckDuckGo or Google. You may even be able to use Bing. Guys, this information is readily available, which is why I always laugh when a doctor says, where'd you get it from, Dr. Google? Guys, there is wonderful, wonderful research when it comes to doing it using the search engine and going on to PubMed and actually looking at the research. I wonder if doctors are even looking at this and studying and trying to further their knowledge and their clinical expertise. Here's what they say: hormonal and metabolic aspects of acne in women with PCOS. So acne in women can indicate a systemic disease, not a skin disease, but a systemic disease, such as polycystic ovarian syndrome, which is associated with, yes, hormonal and metabolic disorders. What are the hormone issues? Testosterone. Metabolically, what is it? Blood sugars and insulin. Now, here's what their conclusions were. The acne global severity scale in PCOS women is associated with higher concentrations of total testosterone, free testosterone, DHE, and DHEA. So this is why, guys, if someone has PCOS, they shouldn't just be measuring their A1C. They should be measuring blood sugar, A1C, insulin, testosterone, total and free, DHEA. They should also be looking at the progesterone and their estradiol, estrone, and estriol numbers. and C-reactive protein, and that's just a start in order to do it. Why don't doctors do it? Because they only need one marker in order to decide if they're going to give someone birth control. And in fact, I've seen women who have been put on birth control without any markers taken. And it's just take these birth control pills, and if the acne goes away, it just means that it's working. Okay. So it is a hormone issue. It is an inflammatory issue. It is an infection issue in the gastrointestinal system. So here's the takeaways, guys. Acne is a symptom of high inflammation, high insulin, and high androgens. And many times it's all three. Medicine's gold standard is suppressing symptoms that will set you up for further disease. It'll just set you up for further disease. It's just kicking the can down the road. So meanwhile, in your pursuit of having clear skin, you're still sick. And that's why, guys, it is so important to get to the cause, get to the reason why it's happening in the first place. You have to address what's happening systemically, inflammation, and if there's any kind of hormone problem. But remember, hormones respond, they don't cause. So here is what you can do, okay? Here's what you can do. Number one is that you have to get tested. Guys, there is no protocol that will help with acne. Well, Dr. Nate, I did a couple of things and it helped. Well, congratulations. You were a blind squirrel that happened to find a nut. And that's what I say is so many people, they're blindfolded and they shoot an arrow at a target and they happen to hit it. And then they say, follow my protocol. It will work for everyone. But there is no protocol, guys, with what we do. In fact, I was having a consult with someone who tested positive high mold in their house. And they're like, well, what's the protocol? I said, there is none because we go in 19 different directions. But here's the first step that you need to do. And the first step that would be for you would be to get tested. Food allergies are huge when it comes to acne. Stool testing, huge. Dutch testing, especially when you're talking about hormone issues, especially with women, when you're talking about PCOS and things like that. You should also be testing blood, A1C, insulin, C-reactive protein. These are some other tests that you get. If it's a male, I'd probably be looking at stool and be looking at food allergies. If a female, food allergies, stool, and then probably even looking at Dutch testing and then looking at their insulin levels, A1C and CRP. Number two, here's something that you can do is that, yes, one of the things that you can help with the skin is because remember, you got to feed the skin as well. It's also an organ, which is why getting higher levels of vitamin D, or I should just say adequate levels of vitamin A, the best, guys, source of vitamin A is going to be from grass-fed, grass-finished beef liver, okay? I had an argument with someone who said liver is the worst food because it stores toxins. No, it doesn't. The liver does not store toxins. It processes toxins. Where you store toxins is actually within your fat cells and neurological tissue. You do not store it in the liver. So you don't want to have, though, grain-fed liver. And the reason why is you feed it grain, you feed it sugars just like a human, you will be eating fatty liver. So you'll be eating an inflamed liver. Number three, vitamin D with K2. Vitamin D3 with K2. I want you to think about it. If going in the sun, oh, Johnny's acne is so much better during the summer, okay, that should leave you clues that maybe vitamin D production plays a role with the health of your skin. So now you in the wintertime, you can't get out in the sun, and now the acne gets worse, which is why I almost believe that almost everyone, especially if you're living in a northern latitude, should be supplementing with vitamin D, especially during the winter months for about 6 times per year. So those are 2 things that you can do right now is start taking a liver glandular and also supplementing with vitamin D3. How much should I take, Dr. Nate? I don't know. I don't have any of your numbers in front of me, but a good place to start, generally speaking, and I say it generally, is 5,000 IUs of vitamin D. Sometimes people don't have a gallbladder. We put them on 50,000 IUs for about 2 months. And sometimes people only need maybe 2,500 per day, and that depends on body fat percentage and their gallbladder function and things like that. So guys, if you found this valuable, please share this with other people. Please give them hope that there's a different perspective out there that can help them when it comes to handling acne, because remember, it's a symptom. There's much bigger things that are happening, and that if you don't address the cause, you're only kicking the can down the road for much more serious problems than just your skin later on in life. And again, if you're watching from the Chicagoland area, guys, and if you want to work with our office, with myself, with Dr. Brian and our wonderful staff, make sure you go to the top of the page to the link for the inflammation talk that's going to be tomorrow night, Tuesday, December 6th at 6 o'clock p.m. This is an in-person event, and we will be talking about inflammation, the first steps that you need to do. But guys, you cannot get better if you don't know how to handle those inflammatory triggers and find actually where they are coming from. So go to the top of the page from the Chicagoland area, get registered for that, and we'll see a lot of you who might be watching tomorrow night, Tuesday, December 6th at 6 o'clock p.m. for the inflammation event. But guys, if you found this valuable, make sure that you share this video with other people. I always appreciate it. And as always, I'm sincerely thankful. I'm humbled that you would listen to me. I appreciate it from the bottom of my heart, and I appreciate when you share. I appreciate all your wonderful comments as well. So guys, be well, be blessed. I hope you have a great rest of your week, and we will talk to you next week for a brand new topic. So guys, be well, be blessed. We'll see you.